SkarxFace talk real. No filters here. We love too hard. We argue then cheer. Red flags up. Shots in a cup. If it's messy, then you know it's uncomfortable convos.
Yeah, we toxic, but we vibe in a style. Couples fighting in the club, all smile.
And we're live. Welcome back to Uncomfortable Convos. It's your boy, the one with the scar on his face, your boy SkarxFace, and we're back at it with another episode. And I know on the live the other day, I teased this podcast because there's a lot of men who struggle, you know, and some women too that struggle in being intimate, relationship, kinks. You know, that's all we talk about. So I'm glad you guys have reached out and wanted to do something as well, because I was actually looking for somebody to do a similar podcast. So we have Naomi, right?
Yes.
From Beso Wellness
Yes.
and Beauty. And so just met her. She's great. And I'm excited to get into these because I had people also send me some questions and stuff because they're also curious. And we actually talked a little bit off camera about how guys sometimes maybe they struggle too, but they wait until it's too late. They wait until now it's a serious thing. Maybe their relationship is about to be over because they've waited way too long to get some sort of treatment. Because right now, ED is one of the biggest things that the girls send me messages about. They're like, my man has this. My man, what do I do? I'm like, he needs to go to the doctor. There's no a book he can read that's gonna be read this scripture and then all of a sudden, guess what? We're back. We're back at it. So, so thank you for being on the podcast.
My pleasure. Thank you for having me.
So I want to get to know a little bit about you before we get into all the procedures, because you have a great, you call these spas, right?
It's a wellness center and med spa.
Med spa. Okay,
Yes.
There we go. And so how long have you had this one?
This one, it's actually going on 3 years. This end of this month, we're gonna celebrate our 3rd anniversary.
Oh, nice.
Yeah.
3rd anniversary.
Yes.
And how long have you been doing this for?
Well, I've been in the medical field for almost 20 years. I got into regenerative medicine, sexual wellness, bioidentical hormone replacement. Kind of got into all of that about 6-7 years ago.
Mm-hmm.
Just developed a passion for it.
When did you start thinking about doing offering sexual wellness procedures?
As soon as I learned about PRP, platelet-rich plasma,
Mm-hmm.
and just stem cell therapy, exosomes therapy, as soon as I learned that, that's when I got into non-surgical hair restoration. And it just went from there because we were using PRP at the time to help patients who were losing their hair. And then I learned about all the other things that we can do with PRP.
Mm-hmm.
Sexual wellness is one of them, treating erectile dysfunction, treating women who have low sensation or just low libido, and what we can do with PRP. So
Okay.
it just went from there.
And so it was the men that got you into. You don't have to tell me. Was it because somebody that you knew was struggling in this area, or was it just because
No,
it came across?
It just, again, because I was working with PRP, literally just using platelet-rich plasma to treat, hair loss.
Mhm.
And again, just learning more about it and what we can do with it. It's like, oh my gosh, we can actually, help men with ED. We can help women, who have low, desire or have a hard time orgasming. And then, of course, I learned the other things, with PRP, we can use it for aesthetics. So, for example, I'm sure you've heard about the vampire facial. That was big. Kim Kardashian was the one that first did it. And, everyone was talking about it.
Is it blood from?
It's literally, it's her, your own blood we draw, we spin it, we separate the red blood cells, and we have your plasma, which has your growth factors and some stem cells. And that's what we, for the vampire facial, for example, we use that for aesthetics, topically. But then we can also take that plasma and inject it. Again, for hair restoration, we inject it into a man's penis. We can inject it into a woman's clitoris, into her vagina.
Mhm.
We can actually inject PRP into joints even. So if someone's having issues with their knees or their shoulder, their ankle, doctors say, oh, you're going to need a knee replacement. Well, maybe not, because we can actually reverse that
Mhm.
with PRP. So that's really what kind of just when I learned about all of that, I was like, oh my God, this is amazing. We can actually heal the body using its own body.
Yeah. Yeah. And I'm glad you do this type of stuff because I've heard of some of these things. It just, when you really don't know, you don't know. Right.
Of course.
And
Yeah.
I was going through you guys' website and you guys offer stuff like the O shot, P shot, shockwave, TRT, clit, clitoxin,
Toxin.
clitoxin, peptides.
Yeah.
And so I was like, I had no idea that a lot of these things were available to some guys. And I know a lot of, if I don't know, I know there's even a bigger amount of guys that don't even know that you can do this because, like I mentioned before, one of the biggest things that these girls send me questions on is my guy went soft or he doesn't, I try to do whatever I can to him and he can't stay up or he can't get hard. And it starts, they start blaming themselves first because they're like, am I not attractive? Like they get in their own head.
Right.
And I tell them, I'm like, it's not you, it's them, you know? And then we also had Veronica a while back ago, and she talked about how it can be a bunch of different things. She said performance anxiety, like stress, like also, it doesn't, not necessarily that, but I think she's the one that mentioned that there's different procedures that you can also do.
Yes.
So that's why I was like, I'm excited for this. I teased it on the live and they're like, tell us more. When does this podcast come out? So I'm sure they're super excited and I'm excited to learn so I can, like when I'm giving advice on some of these videos, I can be like, reach out to these guys, you know, when it has to deal with some stuff like this, I don't like to give like therapy, counseling, all that stuff. I'm like, I'm not certified for any of that. And some of this stuff I can be like, well, this is what I was told it does. But to get a better understanding, just reach out. You know, like they're going to give you a solid answer and I'm going to be like, well, I think like,
Right.
I think this, I think that. So you said that you saw this and you wanted to start doing it. Was it because you were seeing a lot of that? Like girls asking about men? Cause I know kind of like when you go get your hair done, you guys become like therapists.
Right.
And they tell you everything. And then, were you hearing a lot of these like type of issues?
Yes. Also, when I worked with a naturopath for a little while. I learned a lot from her. But when I was seeing patients and, you know, just doing initial consultations, just wellness, you know, one of the things I would ask my female patients was, okay, how is your libido? Do you have any concerns with regards to your libido? Do you have a hard time getting to an orgasm? And I couldn't believe what I was hearing. I mean, some women were telling me how they've never had an orgasm. They don't know what it feels like. They don't even know.
They think they had one.
They 100% never had one.
Oh.
And I'm just looking at them like, that's no way to live. I mean, it's just, it's not fun,
Yeah.
obviously, but it's also for your health and wellness, not ideal. You know, the whole point of when a woman has an orgasm is to release, right? And it also helps release certain hormones in our body that help us reduce stress. And it's overall, even for anti-aging, it's just a great hormone that's released when a woman orgasms. So I was a little concerned to hear that, and it wasn't just from one patient, but I mean, I would hear it multiple times.
Yeah.
So I wanted to really understand and get to the bottom of like, why the heck is this happening? And then, I mean, a personal story, when I was in my late 30s, I started noticing that like my energy levels started to decline. Like by the afternoon, I would just feel so tired. I would need a nap.
Mm-hmm.
And like, what the heck is going on with me? Like, I'm not even 40. I still have, you know, little kids, and I'm working and I'm active. Like, I need more energy. But then I'll start noticing like that the libido was just not there anymore.
Yeah.
I'd rather go to sleep than, you know, even consider doing anything, you know?
Yeah.
So, and I, you know, I went to my doctor. I went to my GYN, you know, told them what my concerns were. And they kept telling me everything was fine. Everything's fine. You know, check my hormones. Well, they check my hormones. Everything looks fine. You're fine. You're just stressed. Maybe you just need to rest, take some time off. That was not helping me. Then finally, I reached out to a friend's friend who is a naturopathic doctor. I sent him my labs, and he looked at my labs and said, "Whew, you have zero testosterone, girl. What are you doing?" um, that's before I knew what I know now.
Yeah.
And, I got on testosterone replacement. And then within 2 weeks, wow, what a difference I felt.
Yeah.
And then shortly after that, when I started learning about, PRP, again, regenerative medicine, I got so just inspired, and I flew down to Alabama.
Mhm.
And I trained with Dr. Runnels, who was the inventor of the procedures. He invented the O shot and the P shot and the vampire facials and
Mhm.
the breast lift. And I trained with him, and they were offering us trainees at the time, like, if you want to get the procedures done, you can. So I figured, why not? Let me try
Yeah.
it out, because I like to try things out on myself before I actually offer them to my patients. This way I have personal experience. I know what to tell my patients, what to expect. And if it indeed is effective, then I will offer it. So I got an O shot
Mhm.
while I was there. And let me tell you, I really wished I made that trip with my husband at the time.
She's struggling in the hotel room.
Because, I mean, I couldn't believe how quickly, it's just sensitized things.
Mhm.
And, that's it. From there, I was like, oh my gosh, this is awesome.
And
Those-
I feel like that would be great. I mean, we're going to get into it here in a little bit more for somebody who, because another question that I get a lot is like, my guy finishes really fast. And so she doesn't even get to that place. Maybe that could help in that area. Or like you said, it's crazy that some people have never had an orgasm. And I'm just like, I couldn't even think about like me not ever being, I'd be like, I don't know what it feels like. I'd be like, that'd be crazy. So so doing all that is what inspired for you to open Beso? Or where did Beso come from?
Well, it's one of the things that inspired. Definitely, like learning about the importance of hormones and hormone replacement and optimization, not just for men, but also for women. Um, Kind of went further into that and trained and learned more about it. And then just, again, the regenerative part of things, where like I can help someone's ligament or joint heal
Yeah.
without having them to depend on like steroid injections or surgery. Um, I think just being able to promote that wellness and longevity in people, helping them feel good on the inside and then look good on the outside,
Mhm.
is really what kind of inspired me to open the clinic,
Okay.
be able to offer that, because that's, unfortunately, it's not something that traditional Western medicine will offer.
No, yeah, absolutely. And when you brought up about knee surgery, just any type of surgery where you have to like try to fix something, I've heard more stories of they end up worse. So to me, I would recommend, hey, try this first before you actually take that knee surgery, because that's why Ozzy Osbourne, he ended up doing, I think it was a back surgery that said was going to fix it. He ended up worse. He, even after that, he had said, I wish I would have never got this surgery. And I hear that all the time. Like, I have a buddy who got a knee surgery. He's even worse off. They're like, oh, you're going to be fine. Everything's going to be great. He's worse now. So instead of trying stuff like this, because is it similar to the stem cell?
Yes, it's in that family.
Okay.
So with PRP, again, platelet-rich plasma, that's we call it autologous. So that's something we're actually using from your own body.
Mm-hmm.
Okay, and that's the simple procedure. We just draw your blood. We have a special type of centrifuge, spins the blood. We do a double spin process, which means we concentrate the plasma, so it's abundant in platelets and growth factors,
Mm-hmm.
your own stem cells. The next step is something called exosomes, which is harvested from a human donor placenta and umbilical cord. Okay, those are messenger cells that we inject into the person's body,
Mm-hmm.
depending on what we're doing, and that stimulates your body's stem cells. Okay, to target the areas of healing in the body. The next step up, of course, then is stem cells, where it's also a donor, usually also, human placenta or umbilical derived, but those are actual stem cells
Mm-hmm.
where we're injecting them into the patient's body. Again, it could be scalp, could be penis, it could be joints, it could be spine, it could be
Mm-hmm.
sometimes it's systemic and IV. And that is, I call it the creme de la creme of regenerative medicine.
Okay.
Yeah. So all of that is in the same family.
Yeah, because I've been hearing, the first time I ever heard it was on Joe Rogan. I don't know if you listen to Joe Rogan, but I heard it there, and I'm like, it almost sounded too good to be true. Like, but then you start seeing that other people are doing it, and I'm like, why aren't a lot of people offering this? And I get it. There's like a lot of like things that like why they don't allow it and things. But if it's helping people,
Yeah.
you know, people are actually like out here giving different types of opioids. Like they're willing to do that instead of because every time I get surgery, I don't do pain pills or nothing like that, just because I'm so scared
No, good for you.
that I would get addicted to them.
Yeah.
And so like in November, I got my wisdom teeth taken out, all like 3 of them. And they're like, oh, we're going to give you these. Never took one. I just took Advil or ibuprofen, and I was like, I'll go through the pain. Because my biggest fear is that, because I've seen some people like, oh, it started when I took this, and all of a sudden it led to one thing to another. And I was like, yeah, I don't want that to be me. So since you offer these services for men, is it hard for, like, say, do they get embarrassed coming in, or do they, like, when they come in, say they come in with their wife, their girlfriend, their partner, is there like some sort of awkwardness, some sort of embarrassment?
No. Most of the time they come on their own. They come
Mhm.
by themselves. And many times the partner doesn't even know about it. Okay. They'll come in. I've never had anyone come in who is shy or embarrassed to talk about his concerns. Actually, from what I've heard from my male patients is that they prefer to come to a female provider as opposed to going to a male provider and talking about their concerns and their
Yeah.
issues. So I haven't had any issues with that. And they'll do their research, and usually they'll research like, erectile dysfunction or premature ejaculation, whatever the concern is, and that kind of then leads them to us. So they'll give us a call, we'll get them in, we'll do a consultation, and usually I get a whole full history
Mhm.
because I'm trying to understand like what's the root cause here, right? It could be different things.
Yeah.
It could be an hormonal imbalance. It could be something where it could be something's going on with their nervous system or cardiovascular system. Do they have any underlying health conditions that I need to know about? Is it performance anxiety? Sometimes it could just be something psychological going on.
Mhm.
So I need to get like a full thorough history before I can determine how I can help this patient.
Yeah, and like to the fellow, hopefully your lady or whoever sent this to you, or you just found it. When you come in, they're not gonna make fun of you. Like it's not like they're gonna go and blast it out on social media.
Of course not.
Because some guys feel they're like, everybody's gonna know that I have a problem, so it's more of like an ego pride thing, and so they just prefer not to go. That's why there's a lot of people in relationships, because the guy doesn't want to go get himself checked. He's like, oh, I'll be fine, there's nothing wrong, just for that, like that fear of going in, that embarrassment of going in. Like, and I tell them, especially, it tends to happen to males.
course,
The
yeah.
older you get, the body gets older, some things stop working, and the worst thing that you could do is just nothing, because it's, especially if you're in a relationship, it's really going to affect your relationship. You think everything's fine because maybe she's acting like everything is good and dandy, but in reality, there's a lot of things going on through her head too.
Oh,
So,
yeah. So as a woman, absolutely, I can understand. Like in the back of their minds, they're thinking, "Okay, something wrong with me?
Is
Am I
there
not
someone else?
attractive anymore? Is there someone else? Like, is he kind of getting, getting his thing done, somewhere else, and he comes home and he's satiated, right?
yeah.
Yes, there are a lot of things that can be going through the woman's mind. So there is no shame. If there's something that is going on, there's no shame in coming and getting checked out. First of all, this is a medical establishment.
Mhm.
I'm a medical provider. We're all bound by HIPAA laws. So whatever is talked about, is discussed in the treatment room, it doesn't leave that treatment room.
Yeah.
Okay. So I always tell my patients, you have to be fully transparent with me. Tell me everything. Don't hesitate, because that will help me figure out what's going on, and I'll know how to help you. If you keep something from me, like a certain information,
It could be critical.
it could be critical. Exactly. It could be something as simple as someone maybe has prediabetes, for example, right? That can be affecting their performance because elevated glucose levels in the body can affect the microvessels in the penis.
Mm-hmm.
And what do you need to get a good, hard, long-lasting erection? What's important for that? Blood flow,
Yeah.
right? Not muscles, it's the blood flow, the circulation.
Mhm.
So if our microvessels are affected in that area, you're going to have issues with ED.
Yeah.
And we can do something about that. Like we can help our patients with that.
Mhm.
Or something like a hormonal imbalance, for example. Let's say everything's fine. We have a male who is has no issues. He's healthy and well, and has had no issues with getting an erection. All of a sudden, now his erections maybe are like not as hard as they used to be. They're kind of on the softer side. They don't last as long, or maybe the libido is starting to get affected. What's going on? Well, that could be maybe a testosterone deficiency.
Mhm.
Even if a man's testosterone levels, let's say normally are like at 850, for example, and it declined to like 600, okay, that can affect a man and his performance.
Mhm.
So, getting your labs checked regularly. Okay, if you're, I usually say if you're like up to age 40, if you check your labs once a year, you're fine. After 40, I prefer every 6 months. Things start to change.
Yeah.
Okay. If there's a health condition or if they're on hormone replacement, then I monitor my patients even closer. Every 3 months we do labs.
Mm-hmm.
And that's really critical. It's important. So a man could be feeling fine, thinking, I'm great. I don't have any pain. I don't have any issues. I don't have any concerns. They don't get checked. They don't go for their annuals. They don't do labs. But there could be something going on.
Yeah.
It just doesn't feel it yet. That's why it's important I like to say nip things in the bud.
Yeah, like it's better to go get checked and just make, if nothing's
Early
wrong,
detection, yeah.
you're good. And like that's something that I mentioned earlier that I struggle just going to get a physical, because it's like most guys, we're good until something bad happens or like we feel pain.
Right.
We feel
Right.
like something is off, like when it's bad already, and which is not good because like you should be constantly getting checked, especially the older you get. If you can catch something a lot sooner, which you could be preventing it, you don't want to wait to get to something
100%.
and you don't want your relationship also to end. Like if you're struggling down there, you don't want your relationship to end, like, because eventually you'll get to the point where she's probably like either go find it somewhere else or she gonna end up leaving you and you're like, I can't believe she left me because it doesn't get, you know what I mean? So
yeah, but there's more to it. I mean, in a relationship, like some people say, sex is not everything.
it's a huge part.
It's a huge part of the relationship, right?
Yeah.
I mean, it is. Whether, you could be happy, you can have no issues with finances, like everything's fine. But if there are issues in the bedroom, okay, yes, it will affect the relationship. So sex is not everything, but it
bleeds to everything else.
Absolutely.
Because I did a
100%.
whole podcast on that, like where why intimacy is big in relationships. Because exactly that. Some people are like, well, it's not all about sex. Yeah, but if there's none, it's gonna bleed. Like you're gonna get upset over, like little things are gonna, just upset you. Like, and it's gonna lead to this. It's gonna lead to that. Like just because it all stemmed from because you not being intimate. Because you need to be intimate with your partner. Like it doesn't matter like what people say. And then also, no, go ahead.
I was just gonna say it's just that bond between,
absolutely.
right? It's just a bond between the partners. I mean, even if you had a little argument earlier in the day, you might be feeling kind of like, I don't know, resentful of each other, whatever. But then you kiss and make up, you go to bed, you have good makeup sex. Right?
That's what I was about to say. I'd be that makeup sex fire though.
Yeah, so I feel like that's important, or just like that connection.
Yeah,
that
yeah,
connection.
and you need it. And if that wasn't there, like if you guys didn't even get a chance to have makeup sex, like now it just bleeds on to the next day, and then eventually it becomes a bigger problem. So like I'm glad that you mentioned that. And what I wanted to say before we move on to the next part is, I know you guys see like if you guys go to your page on social media, so when places showcase a certain procedure, they usually get a model. Everything's talked about ahead of time. They're gonna be posted on social media. You're not gonna come in and they'll be like, hey, we're gonna post this on social media. Like no, this is all thought about ahead of time because there was a guy that I know that didn't want to go get his checked because he's like, oh, what if they put me on social media? I was like, oh no, I was like, that's pre-planned. Like, hey, looking for a model for this procedure, anybody available? Yes, you're gonna be on camera. And then somebody who's comfortable enough is gonna be like, hey, I'll do it. You're not just gonna walk in and be like, hey, by the way, we're recording. So just so you guys know.
Yeah, absolutely. We get consent.
Yeah, absolutely.
Some people are comfortable with being on social media and some people are not. They want their privacy, and that's absolutely 100% respected. So we first will ask our patients if they're comfortable with that. And if they are, there's a consent form that they sign. And even then, we're very cautious about how much we actually post.
Yeah. And respectful,
of
everything.
course, yeah.
They'll be like, look, it's not working.
And
Watch me fix it.
Right. And we'll ask the patient, like, how comfortable are you? Like, how much are you comfortable with sharing? So sometimes we ask for like testimonials, for example, and they don't have to tell us, they don't have to talk about the details of like what their concerns are, why they came here. It's just in general, they talk about like their experience with us.
Experience,
right?
The customer service.
I came in feeling a little blah, and now I'm feeling much better. They helped me with my concerns or whatever. It doesn't have to be in detail.
Yeah. So I just wanted to put that out there. That way they knew that was a thing. Because to me, since I do media, like it's common sense. But to other people who don't, I'm like, oh, why? It makes sense. Like they think, because everyone's trying to be on social media now, and like you have to be, but they think that they're going to get filmed as soon as they like walk in.
No, it's a legitimate concern because even when we have patients who come in for like medical aesthetics, for example, Botox fillers, and we take pictures of everyone that we work on, not to post it, but just for our own, just put them in their chart, right?
Yeah.
So then we can show them like a side by side. Hey, here's your before, here's your after. Look at the difference, right?
Absolutely.
So as soon as we tell the patient, okay, we're going to take pictures before we start, they're like, oh, no, I don't want anything posted. So we explain to them that we're not posting this without your permission.
Mm-hmm.
This is just for our
records.
Right, exactly. Yes, we're very careful about that.
No, and I'm glad that we made that disclaimer. So hopefully, guys, be comfortable. And talking about guys, I wanted to get into some of the men's services just because, just on my page, that's the biggest thing. Is the girls always complaining about their guy, And one of the first things that I have here is the P shot, and the question that I have, what is the P shot, and does it actually work, and what are the benefits a guy can get from this?
The P shot stands for the Priapus shot. Okay. And what we use is platelet-rich plasma, PRP. So again, we draw blood, we spin it, separate your red blood cells, we get your plasma. Again, in that plasma is platelets, growth factors, your own stem cells. Okay. The process for the P shot is we numb the patient. We apply topical numbing, which is very, very, very effective.
Mm-hmm.
Some guys, when you ask them, are you good? You're numb. They're like, it feels like a black hole. I feel nothing. So they're numbing while we're spinning and getting everything ready. And then there are 5 injection points. So we inject the shaft, and then we inject the glands on the head of the penis.
Mm-hmm.
Okay. And what that does is it regenerates the tissue.
Mm-hmm.
And it promotes more blood, more circulation to the area. So we're actually getting more vascularization.
Mm-hmm.
Okay. And over time, you get stronger erections, harder erections, longer lasting erections. Some men, they complain of lack of sensitivity. Okay. So it kind of aids in that as well. So usually I have guys that'll come in with concerns of ED, and the P shot is one of the things in the treatment protocol that we recommend. And then there are guys who are fine. They have no concerns, but they know how important prevention is. So they kind of get ahead of the game.
Mm-hmm.
So they'll come in once a year to get a P shot, and that also gives them performance enhancement. Because also when you do the P shot, I never guarantee this to my patients, but there's a possibility that you'll see some increase in girth
Mm,
from the P shot.
okay. Yeah, because it doesn't seem too invasive. Of course, I originally, when I saw that, I was like, yeah, they're going to inject. One of my questions was, is it going to hurt? But you said that you guys numb that. So a follow-up to that is, how long does it last? Like, is it something you have to come in like every 6 months, 3 months?
It's recommended to do it once a year, unless there is a real concern or something like more, more severe going on.
Mhm.
Like I have young men that I've seen who have had patients who are like in their 20s who've had trauma to the area, for example. Or I have guys who, like, when they were teenagers, they didn't know any better and they were taking testosterone for a little while they were going to the gym to bulk up. So that later caused them some issues. So in those cases, we had to do a series of P shots.
Mm.
But normally it's recommended to do it once a year. The nice thing about it, there's no downtime. There's no downtime. As soon as the numbing wears out, which is within a couple of hours after the procedure, I tell my patients, like, there's no downtime. You can go home tonight and have sex. I actually encourage it. Go and have sex. So,
I'd have my girl in the car.
but just make sure the numbing wears out first.
Yeah, you don't want. Well, yeah, that and like you don't want to have numbing because I'll get into that later. But no, but which is great because to me, so you said about once a year, right? Which is nothing bad. It's just like almost like a physical. You come in, you
Exactly.
get checked, and hopefully that fixes it. Is there anything that you want to mention about the P shot that, like, what are the realistic results compared to maybe somebody else is offering this, but they overhype it? They're like, oh, it does this. And you're like, well, honestly, that's probably not going to happen. Is it the girth part? Like, is there some people who will be like, y'all get some size, like every time, but at the bottom it says results may vary.
Well, results do vary, right? Because we're humans, and literally every body responds differently,
Yeah.
right? But like I said, with regards to size, I will never guarantee, oh, you're going to see an increase in size after a P shot.
Mhm.
Okay. But in our experience, we have seen a little bit of increase in girth size.
Mhm.
In not as much in length, but girth for sure. Also, everybody, their response is different, right? How long it takes for them to feel it. Some men, they say, oh my gosh, like within a week, I started feeling just more sensitivity, harder erections. For some men, it takes a few weeks. The full regenerative effects of PRP take about 8 weeks in total to occur. Okay. And then the improvements over time, like you see the improvements more as you go. That's why we say once a year on average is enough. So everyone is different. Some guys within a week, some guys will come back a month later and say, okay, I'm starting to feel improvement. I'm starting to feel something. It just depends. If they're healthy and well, no health concerns, they're going to respond quicker. If they're overweight, they don't lead a healthy lifestyle, they drink alcohol, they smoke, there are a lot of factors that come into it. I will be straight up with my patients. I'll tell them straight away that it might take a little longer for you to feel the improvements. That's why I encourage my patients, actually, before you get a P shot, make sure you're off of alcohol, you're not smoking, you're eating clean. We want the best quality plasma we can get.
Best results.
Best results, exactly. Like, you're paying, to get this done. Get the biggest bang for your buck here.
Yeah,
right?
absolutely. No, and I'm glad you say that because say me and Tim come in and Tim says it works right away. And then I came in, I'm like thinking, hey, it's going to work right away. But for me, maybe it took like a couple weeks, And so I'm glad you say that everybody is different. Just because, say he did get recommended by somebody.
Yeah.
Your results may be a little bit different. Like,
Sure.
the goal is to have results,
Right.
Great
Of
results.
course.
But the effects might take just a little bit longer than
For some, it might take a little longer than with others. Yeah.
instead of coming in and expecting, well, he said it was overnight. I didn't, still struggling here.
If I could just snap my finger and make changes overnight for everyone, that would be amazing. But I don't think there's any doctor, any provider who can really say that, because it's not a thing. Again, the human body it varies for everyone's different.
Yeah. And I know one of the other services that you offer here is shockwave therapy, and that's also targeted for ED.
Yes.
And so how does that work? And how does it differ from like maybe some sort of Viagra or like pills like that?
hmm Well, with shockwave therapy, that's acoustic sound waves. That's sound wave therapy, right? So what it's doing is the waves penetrate deep into the tissue, all right? Strengthens the pelvic muscles. Also, if there's any plaque buildup in the vessels, um, it breaks up the plaque tissue, clears out those vessels. Also, what shockwave is doing actually is those sound waves, um, they actually stimulate your body in that area to produce more of your own growth factors, and also stimulates new vascularity, new blood flow, new circulation. Okay. So it does a combination of things. There are some men who have something called Peyronie's, where they have like curvature. Okay. And that could be because of like fibrous tissue or like scar tissue that developed in that area. So with shockwave, we can actually break that up also. Now, I always tell people not all Peyronie's is bad.
True.
Depends on it depends on the curvature and where the direction, the angle, and the direction it's curving in.
Yeah.
But we can treat that with shockwave. Okay. But the difference between that and Viagra, I mean, Viagra is just, I mean, it's a pill that you take. It's in your system for about 6 hours. And what that's doing is just, it's opening up the blood vessels, right? It's dilating the blood vessels so you have more blood flow. And that's what gives you the erection,
Yeah.
right? But then you have the side effects of Viagra, which they're not fun.
Yeah. If it lasts more than 4 hours, go get
And then
something.
that's right, priapism, right? So if you have an erection that lasts more than like 4 hours, you're in trouble. You better go to the emergency room.
Yeah.
With shockwave, obviously that's not going to happen. With shockwave therapy, we are regenerating that area pretty much. We're healing the area. So again, if there's any concerns with plaque, any concerns with like the microvessels in that area, we're healing it. Okay.
Yeah.
So I would say like you get with these types of procedures, you get more bang for your buck long term, right? Because it's regenerative.
And so I'm assuming this one is also like maintenance based, like where you have to keep coming in. And how often is that?
So for some men in the beginning, it depends on, their concerns. For some men, they need a series of 6 shockwave sessions where they'll come in like twice a week for 3 weeks, or they'll come in once a week for 6 weeks. They'll get that done, and then they're good. Like they'll come in maybe, once in 6 months then for like a maintenance, just get a session here and there, and they're fine. Some men just love how they felt afterwards. And they'll, we have some men who will come in like every 3 months, quarterly, just get a session, and they're good. I had a patient who he was in a long distance relationship. So every time he would go visit his girlfriend,
He got nice and ready right before. Say, that's smart.
Yeah, he would just buy a package, and then like whenever he needed it, he would just come in and get a session, and we'd be like, okay, he's probably going to go visit his girlfriend this weekend.
He's like, I need to go make sure she's good.
Right.
Which is good on his part too.
Right,
Like
sure.
there's some guys who don't even do that. They just show up with. It's funny because I'm making fun, like joking around with guys. I call it a disability. I'm like, they showed up with their disability, and
Right.
then they make it. Sometimes they make it feel like it's their fault. Be like, it's your fault. I can't.
Frustrating. That is frustrating.
And
No,
and
yeah.
imagine like long distance relationship. You're finally gonna see your person,
Right.
and then you get there and it's awkward.
Wah.
Yeah, it's not working. So another thing that you guys offer, because it could also, and this is why it's great to get a hold of you guys or just wherever you're at and find out what the cause is, because it can be a multitude of different things.
Yeah.
So I started TRT a while back ago because I took a supplement that shot your testosterone. And it was this local supplement shop started selling this, and they're like, this is great. It's going to get you all sorts of results. It got you results, but it also messed up a lot of other stuff that they didn't tell you about, and nobody knew because it was just new stuff, right?
Yeah.
And so, because I started feeling tired, I was like, why am I so tired? And then I had a buddy who also took the stuff. He's like, I had to go get my testosterone checked, and he got himself checked, and I was like, maybe that's it. And I went, and I was in like 200 level. Yeah,
Oof.
but I was still forcing myself to do stuff, because you're like,
Sure.
well, maybe it's normal. People at that time, I was probably like 29, and I'm like, maybe it's normal that people feel like this at this age, but it's not. And so I started on testosterone, and they just say it helped everything.
Oh yeah.
You know, like it helped your energy, it helped like your sex drive, it helps everything. And now I'm just like, why haven't you gotten yourself checked? I was like, and so this is one of the things that I always say, maybe it's this, especially the older you get, the less your body starts producing. And so it could be, and I'm not saying it's the reason why they're going through this. I'm like, it could be one of the reasons. And so, I mean, you guys offer it. And for those that don't know, you want to explain what TRT is?
Yeah, testosterone replacement therapy. And yes, as we get older, our body produces less hormone. Like women, they go through perimenopause and menopause, which means their ovaries are slowing down. And the ovaries are what, produces the hormones that we need that are important for us. For men, it's the testicles. Okay. And as men get older, they go through something called andropause, which means their testicles are slowing down and they're producing less testosterone. And you start to feel it. Yes. I just want to clarify something, by the way. People think in general that testosterone is a sex hormone. It's so much more than that. It's so important to our health and wellness for men and for women. Okay. Testosterone is important for our cardiovascular health, our heart health, our mental health. Okay. Our bones, our muscles, and of course for, our sex drive. So sometimes I hear this from my female patients or even from friends, right? Where they start noticing that their partners, their husbands or boyfriends, are not as active as they used to be. Not just sex wise, but like in general, right? They'll come home from work, they'll have
Just
their
lay
dinner
down.
and they just lay on the couch and they'll scroll or they'll watch a movie and they just fall asleep. They're not motivated, to do anything around the house or start projects, complete projects or just, go out, and have a good time. Like they used to before. And of course they start to notice that, libido is starting to get affected with them as well. So they'll reach out to me because they know that this is what I do. It's one of my specialties.
Yeah.
And they say, oh, I brought it up to my husband and he got offended. Like he said, I'm fine. Everything's fine. So I tell them, you have to be cautious and you have to know how to bring it up to a man. Okay. If you're going to just tell him, hey, I feel like, your libido is not what it was before, or like, our sex life has kind of diminished. They're going to take that offensively and they're going to become defensive and be like, oh no, everything's fine. If you present it to them differently, like, hey, did you know how important testosterone apparently is for our bodies? For your, your energy levels, for your mental clarity, for your psychological health. They pay more attention.
Yeah.
Okay. And it's true. When your testosterone levels are low and you've experienced that, you're fatigued. You have
Like as soon as you wake up.
Yeah, you're fatigued. You have brain fog, right?
Yeah.
It's hard to concentrate and focus on things. Like you're just not motivated to do anything. You just want to veg out on the couch and just, we power through. We have to work and we have to support the family. We got to make money. But then when we come home, we're like, ugh, blah. But why live like that? That's not normal.
Yeah, that quality of life sucks.
That's poor quality of life. So it's important to get your hormones checked regularly. Of course, there could be other things going on. Men can be anemic where their iron levels are low for whatever reason. That can cause them to feel fatigue and brain fog. So, if we take care of that and optimize that, they feel better. There are different things that can be going on. It's not always just testosterone deficiency. It could even be a thyroid that's sluggish, kind of functioning slow. So that's why I like to do a full panel. I like to check everything and put the pieces of the puzzles together.
Yeah.
Right. Because it's not always testosterone. At a certain age, yes, I expect to see that testosterone levels are going to be low. But that's not always the case.
Yeah.
Even something like simple, like a deficiency in vitamin D, believe it or not. Vitamin D is a hormone. I don't know if you knew that. People say, that's vitamins, big deal. But vitamin D is also a very important hormone. And if vitamin D is low, okay, we're going to feel fatigued. It's going to affect our mood. It's going to affect our sleep. It's going to affect our cognition. And it's also an important immunomodulator. So our immune system depends on vitamin D. So that's why it's important for people to look at all of those things. Okay. Now, if testosterone is a concern, if it is indeed low, and the patient is reporting to me all of the symptoms of low testosterone, absolutely 100%, I will encourage them to get on testosterone replacement. And within 2 to 3 weeks, they start to notice a big difference. And then, once you start, you're like, I'm not getting off of this. Like this, I feel amazing.
Yeah.
Right. Um, there are different cases, if patients are younger, and they want to have kids in the future, they want to conceive. Obviously, we're not going to just jump to put them on testosterone replacement. We'll look at other ways, to boost their levels up naturally as much as we can. But when we're seeing patients like over like mid to late 30s and their 40s and up, then we know for sure already that's like just a natural decline in their levels. And we simply put them like on a once a week injection, or we just pellet them, testosterone pellets.
Yeah.
So we'll put in some pellets, goes right under your skin, so like fat tissue, looks like a little grain of rice.
Yeah.
And they're good for 6 months.
Yeah, I learned about the pellets last year. And another thing that I learned, and you also mentioned it too, is testosterone is not just for men. Like women struggle with it too as well. And I had me as a guy thinking, oh, the testosterone, they're like, oh, that guy has a lot of testosterone. So I'm always thinking it's a guy thing.
Right.
I never realized that it's also a big issue with females,
It
like
is.
with girls. So also this is something that you should also get checked if you're also like struggling, like fatigued
Absolutely.
and things like that. And a pellet is really, if you're not into needles, because the pellet, I guess you guys just put it in and then sits for 6 months and it does its thing, which I don't know if it's true. I've heard that the pellet is way more effective than the shot.
The shot is effective, yes, but then what happens with the shot is you get ups and downs, peaks and troughs in the levels, right? So you inject, let's say on a Sunday, and you get a peak, which your levels increase, and then for a few days it's kind of up there, and then it starts to decline, and so you start to feel like the burn off, days maybe 4, 5, and 6 until you're ready to inject again. So there's that to take into consideration. And then there are people who just they get tired of poking themselves once a week. We have some patients who will come in once a week to get their injection here, or we have patients who we'll just send them home with a testosterone kit and they inject themselves. I started personally with injections weekly, and eventually I just got tired of that. I got tired of poking my butt every week and having to remember also. So I switched over to pellets, which game changer. I absolutely love it. Because with the pellets, what happens is you get a slow, steady release of the hormone in your system. So you don't have those ups and downs.
It's consistent.
It's consistent, exactly. So it's as if your body is producing the hormones naturally, okay? And for men, the pellets are good for 6 months. With women, because we need a lower dose of testosterone, it's in our body for 3 months. So we have to repellet every 3 months.
Okay.
Now, testosterone is very important, like you mentioned, for women as well. We need testosterone, but not in such high levels as men. And the same goes for estrogen. Estrogen is a woman's hormone, right?
Yeah.
Well, men need estrogen as well, but in lower levels. So when I look at labs, I want to see an estrogen level, like an optimal level in men as well, because it's important for your bone health, for your heart health. If you're too low, that can affect, again, bones, muscles. It'll also make you irritable.
Yeah. and I'm glad you bring this up because there, like I said, I was the other way with testosterone. So meaning like girls don't need it, but it actually is a big thing. And then same with guys, we need some sort of estrogen as well, but the best thing you can do, they're not, because some people they want to do a full panel because they're trying to get more money. No, they're trying to see what the problem is. The worst thing is like, let's check this. Oh, that's not it. Let's check this.
Yes.
That's not it.
Yes.
Let's check this. Instead, let's look at everything and see where the problem is at.
Yeah. And also there's something called tunnel vision, with in the medical field, right? Where you have a provider who specializes in one thing and that's all they're looking at, right? So I don't like that.
Yeah.
Again, yes, there could be a hormonal deficiency, but there can be a few other things going on. So that's why I like to get a whole panel.
Yeah. Yeah, because it also comes down to like maybe Tim is struggling with ED and his buddy told him, hey, testosterone help me. So he comes in, he's like, I need testosterone. That's what I need.
Right.
And then you come to find out your testosterone was fine.
Exactly.
It's something else.
Yes, yes, and I've seen that, and I
Mhm.
see that all the time. Where testosterone can be fine, but oh my gosh, you're like severely iron deficient. What are you doing? Right? So we'll put them on an iron supplement. We'll optimize that, and they feel much better. Everything's fine now.
Mhm. No, and so, and there's also the right way to be on testosterone replacement. And there's people who obviously abuse being on testosterone because they take way more than they need,
Right.
or they're using it for other reasons. What are some of the side effects they can see taking healthy amount, and what could happen if you abuse the testosterone?
So glad you brought that up. Thank you.
Mhm.
Because yes, there are ways to get testosterone, without a provider.
Yeah.
I've seen this as well. The right way to do it, okay, number one is always check your labs. Do you need it? Indeed. And then, we prescribe a therapeutic dose, which means that we want to get your levels up to what it would have been naturally, okay? If you overdo it with testosterone, well, number one, then we're concerned about aggression, right?
Mm.
Number two is we're starting to be concerned about your health in general, because too much testosterone in the body is also not good. What it can do is stimulate your bone marrow to produce more red blood cells.
Mm.
And then that will make your blood thicker, which then can cause other issues like stroke, heart attacks, things like that. Also, testosterone, too much of it can be like an irritant to the prostate. Okay, so that's another thing we look at closely. We make sure always that the prostate numbers and levels are healthy. So if you're just poking yourself, you're injecting with testosterone, you're just kind of
Just all willy-nilly.
yeah.
Right?
So there are a lot of health issues that can start to arise from that. And I have treated patients like that where they get testosterone from.
Yeah, because they're using it more for cosmetic purposes.
Understandable, right? They want to bulk up,
Yeah.
right? They want to perform better in the gym. We can help you with that too.
There's a safe way to do it.
There's a safe way to do it, right? Optimize testosterone levels, and sometimes we'll use in combination something like peptides.
Mhm.
Are you familiar with peptide therapy?
A little bit. I've been learning a little bit. There's like a bunch of different peptides.
Oh yeah. Oh, our body produces like thousands of different types of peptides for
Mhm.
different needs. But, the more popular ones nowadays are those for, burning fat, building muscle, right? There are peptides for hair growth, for skin, for
Mhm.
nails. There are peptides for, sexy time peptide, the PT-141.
Yeah, the first one that I heard was, I think it's called like semi-glutide or
Semaglutide,
Yeah.
yes. So that's a peptide. Thank you. That one is used for, originally was FDA approved for diabetics
Mhm.
to reduce their A1C, but also was approved for weight loss. So like everyone nowadays probably is on semaglutide.
probably.
So yes, that's a peptide as well. So peptides for different things. So if somebody wants to bulk up in the gym, right? We'll put them on a peptide like CJC with ipamorelin, for example, or tesamorelin.
Mhm.
It just depends on what their goals are. And it's great because it works and it's
Yeah.
natural. So you're not injecting like a synthetic growth hormone into your body. What the peptides do, it actually stimulates your pituitary gland
Mhm.
in your brain to produce more growth hormone naturally
Instead of injecting yourself with some of these
with synthetics.
crazy.
Yeah.
Yeah, I've never done anything like that. Like I've had people offer me, they're like, hey, like jump on this. I'm like, bro, I have no idea what that
Good
is.
for you.
Like injecting something like that. And I've always seen like it can lead. They're like, but you have to be careful. That already is making me nervous because
Right.
you're like, take this, but like make sure you're taking this, stack it with this. And I'm
Mhm.
like, that is way too much. I'm more of a like simple, like convenient, like if they told me I had to do like a large step of like testosterone stuff, be like, you have to take this one and then take this one, and I'd be like, you know what? Is there an easier way?
It's too much work,
Yeah,
right?
it's too much work. And I felt like that with not only am I scared to inject that stuff into me, So I'm trying to be here for a while. You know what I mean? Like
Yeah.
I'm not trying to
Exactly.
hurt myself. But if you do want to get, that's why it's great that you mentioned that. If people want to get bigger in the gym, but there's healthy ways to do it. Uh, not just the bro science way. Go get a stack from somebody you probably don't even know and injecting who knows what into your body. So the next one that I have here, which I'm curious about, is Botox and Scrotox. What exactly is that?
So Botox, that was also invented by Dr. Runnels, who's the pea shot inventor.
Mm-hmm.
Botox is literally we're injecting Botox into the penis.
We get some size. That's what we're doing.
Well, we get a little bit of size, yes, but mainly that is for firm, hard, longer erections.
Okay.
Okay. That's Botox. Then there's Scrotox. So Scrotox is where we're injecting Botox into the scrotum.
Mm-hmm.
And that's done for two different reasons. For some men, it's for aesthetics. And then for others, it's because they have discomfort.
Mm.
Some men, when their testicles retract closer to the body, it gets really painful.
Mm.
Okay. So we inject those certain muscles to prevent that from happening. And then when we're doing it for aesthetic reasons, there's some men who come in, they're like, I don't like the ridges. I just want to smooth things out. Okay, well, we can do that. There's a different, injection technique, but we use Botox for that as well.
Mm-hmm.
Again, just in different injection techniques and injecting different muscles.
So this one is more of cosmetic purpose.
Well, again, cosmetic, yes, but in regards to Botox, it's more for guys who just want a firmer erection.
Mm-hmm.
Like I'm talking about.
And so that's why they would feel like it maybe grew a little bit because they weren't getting that hard before.
Yes, but also when we inject the Botox into the shaft, okay, we also target certain muscle groups there so that it the muscle relaxes a little bit and kind of lets go. So when you're even flaccid, okay, it looks a little bigger.
Imagine you're taking that and then for some reason you stop taking it and then the girl's like, what happened? You lost some inches on there, buddy. What is going on? Because that's what the first thing that I was like, imagine you stop taking some of this stuff that actually does make you a little bit bigger. And then she's out of nowhere. She's like, what happened?
You're not going to see an increase in size in regard, with inches. Okay.
Mm-hmm.
That's something else. Actually, we can help with that if you want to do that, but that's not with Botox. You don't see such a massive increase, but again, what you do see is, I guess the quality of the erection.
Yeah. It's a lot harder.
It's a lot harder.
There's a difference. And I know because there's some girls when they send messages, they're like, it's not as hard anymore, and it could be, different reasons for that.
Yeah. It could be low testosterone. Just that itself, optimizing that, bam, can change things.
Mm-hmm.
Okay. But it could be that. It could be just maybe not enough blood flow to the area for different reasons. Again, smoking, because that affects your circulation. Or even, guys who have been, smoking marijuana for a really long time, okay, that'll actually affect your hormones as well and the quality of your erections. So it'd be different things going on. Again, that's why, the consultation process when my patients come in is really important.
Yeah.
And unfortunately, we hear this quite often. Some people call and be like, I just want to come in for the procedure. I don't need a consultation. Well, that's great and all, I can do the procedure, but what if maybe you don't need that procedure, or maybe there's something else going on that we need to treat in a combination of things.
Yeah, because if they come in for that procedure and then you're like, all right, I'll do it, and it doesn't work, now it's your fault.
Well, that
yeah,
right.
They'll be like, they'll blame you.
Yeah,
they'll be like, that it doesn't even work. You guys don't know what you're doing.
Right.
But you're like, you didn't even want to do the consultation, and so that's what some people don't understand. Like why do I have to go in for a consult? Because they're trying to figure out if you even need that. And then two, to actually put you on the right path.
Right. Create the correct treatment plan, customize it to you.
Yeah, because like you mentioned earlier, everything is different. So, and then I think we mentioned this earlier too. There's peptide therapy for your libido. Is that anything else that you want to add to that? Because I know that's like another way that you can treat. Is this for ED?
So it's for a number of different things. ED, yes, but there's also hypoactive sexual desire, right? Like for women, for example. And that peptide actually is very helpful because you inject that peptide and it sort of gives you the effects of a Viagra where everything gets sensitized, but not just in the, the genital areas, just your whole body. So the experience is more pleasurable. Okay. So for it works for women as well. So I love this peptide. Say, I might have my male patient purchase it and keep it at home, and I tell them, like, your partner can use it too. You can be spontaneous. If you're going on vacation, take it with you. The nice thing about it also, it stays in your system for like 48 hours.
That's a lot. Yeah.
It's fun.
Yeah, I'm sure it will.
Yeah, and then again, you don't have to worry about like the side effects of Viagra. So Viagra with men will cause like headaches, could cause their blood pressure to go up. Again, that risk of priapism where they have an erection for like 4 hours or longer, then they have to rush to the hospital. There's none of that with this peptide. It's
Is
very
there
safe.
any side effects?
So mild little, like I would say mild side effects that some might experience is maybe a little flushing. They might feel like their cheeks are a little flushed. They'll get like a little heat wave. It's very short-lived. They might feel that for maybe about 5-10 minutes, and then it's done. And then the rest is just like, whoa, like I just feel like super sensitive, and like you actually want to initiate sex.
And this is because does it make the orgasm even better,
Yeah.
right?
Oh, yeah.
So would this help? I know we talked about this. Would it help a girl who struggles getting an orgasm get one quicker?
It can help, yes.
Okay.
Absolutely. Again, because what's happening, you're increasing blood flow, and that gives you more sensation. You become more sensitive.
Yeah, because there's some. We mentioned it earlier. There's some guys who don't last very long in the bedroom, and maybe doing something like this can help you. Because some guys just don't. I get this one all the time. They're like, my guy only lasts like 2-3 pumps, and I'm like, what?
Well, that needs to be addressed.
Yeah, that's a whole different issue.
Right.
Is there something that you guys offer for a guy that can to last longer? What is that you guys
Again,
offer?
the combination, the P shot with the Bocox.
It'll add endurance to that.
For sure.
Because I'm not saying guys should last an hour. I feel like an hour is way too long.
I agree.
Anywhere from like 10, 15, 20, like 30 minutes, go multiple rounds, right? But something over that is maybe something wrong with them. And then since you have this, maybe it may make them last a little bit longer. Is there anything, because another one that I get is like, my man, he never finishes. Do you guys offer anything like that to help that can be a bunch of other reasons too. Like one of the biggest one is like they watch these online videos a lot, right? And they're addicted to those videos. So that's no supplement's going to help them there. That's an addiction.
Addiction, yes. And also men who masturbate, a lot. That can also be the cause where, like, when they are actually having penetrative sex with a woman, they cannot orgasm. Like they have to pull out, and they like have to masturbate in order to do that. So there are those other issues that need to be addressed, and sometimes that like will be in a combination with like a sex therapist at that point.
Yeah. No, so we talked about the peptides. One thing that I wanted to, because you mentioned a little bit earlier how to address this with your partner. Like, what are some ways a woman can address this to their partner? Because guys, our ego, our pride, if you bring up something like this, sometimes we feel like you're attacking us. And so, which you're not, you're just trying to help. And it also depends on how you say it. Like you mentioned earlier, how it comes. If you're like, you do this, or you like, if you're attacking, pointing fingers, he's instantly going to go into defense mode.
Of course.
It's like, why are they, is there certain ways they can bring some of these topics up?
Yes, absolutely. I always offer to, I'll send you information,
Mm.
just information on the importance of testosterone in our bodies, right? So a way to bring it up is like, hey, I just learned how important testosterone is to our health and wellness, our heart health,
Mm-hmm.
our bone health, right? Our mental health. Oh my gosh, look how important this is. And the fact that, at a certain time, at a certain age, men's testosterone levels start to decline. And that's when you start to notice that certain health conditions start to develop. For example, obesity.
Mm-hmm.
You see men with their beer bellies, right? They start to put on weight, that mid abdominal section,
Mm-hmm.
or metabolic syndrome, for example, like their A1C, like their glucose levels, their sugar levels start to increase.
Mm-hmm.
Cholesterol levels start to increase, right? Hypertension, which is blood pressure,
Mm-hmm.
starts to go up. Also, men start to get they start to get lazier,
Yeah.
right? Maybe even depression. They get irritable. They can get moody, just like women do. So I feel like if you present it in this way, where, oh my gosh, it's so important for our health and wellness, maybe we should go get checked out.
Mm-hmm.
Do it together. Go get a blood test, go get checked out. And, if the levels are indeed low, then leave it to me, to bring it up to the patient. Like
Mm-hmm.
I'll literally sit down and I go through the lab report, and I take my time to really explain things. And I explain why their testosterone levels are low and what they possibly are feeling.
Mm-hmm.
Sometimes I don't even need them to tell me what they're feeling. Like just based on their labs, I'll tell them, okay, you're probably feeling X, Y, and Z, right? This is what you're experiencing. And they're like, how did you know? I know. I
Yeah,
see.
based off of the labs.
Right.
Um, but what if, because sometimes even your partner talking to you, the guys are still defensive. There's nothing wrong with them. Say they're listening to the podcast. What are some things that could happen to their relationship if they just completely avoid stuff like this?
I've seen relationships really struggle, um, even get to the point of breakups and divorce
Cheating too.
and cheating. Absolutely. So why get to that point? Let's be open minded, okay, and let's just understand that certain hormones are just important for us. There's no attack. There's nothing negative about it, and there's no shame in that. Again, like menopause is talked about all the time in women, right? It's like a natural occurrence in our lives, but it doesn't mean that we have to suffer
Mm-hmm.
through that. Same thing with men. Andropause is normal part of aging, right? But we can do something about that. We're very fortunate nowadays that there is bioidentical hormone replacement. There's testosterone replacement. Why not address that and optimize that? Like I have a patient. Give you an example. I was like giving examples,
No, that's
right?
perfect.
I have a patient who came in to see me. This was a couple of years ago, and well, my first question is like, "What brings you in today? How can I help you?"
Mm-hmm.
Right? He says, "Well, my wife made me come. She dragged me in here." Okay. He's like, "I feel normal. Everything's fine." Okay. Well, she must love you very much.
Mm-hmm.
She cares about you. So let's just do some labs. Let's see what's going on. And he was, he's telling me how like his energy levels are fine, and he feels like his libido is fine. He doesn't have any concerns there. But then he mentioned how in the morning when he wakes up, he's got some aches and pains, and his joints are aching, and he's like, it just takes me some time to really like kind of
Get going.
get into the flow of the day, right? Okay. And by the way, he was very overweight.
Mm.
He was overweight, and his labs were just a mess. I mean, the guy was pre-diabetic. His cholesterol levels were elevated. Like his liver, he had a fatty liver because he was overweight. So, and then he's telling me, "Oh, I feel fine. I feel normal." Okay. The good thing about this patient was he's very compliant, though. So when I went over his labs with him and explained and broke everything down, he said, "Tell me what I need to do. I will do it."
Mm-hmm.
Okay. So we got him on a treatment plan, got him on a protocol, and included in that, of course, was testosterone replacement because he was very low.
Mm-hmm.
He's in his At the time, he was in his early 40s,
Mm.
and his testosterone levels were in the 200s.
Dang.
Yeah. So we got him on a protocol. He lost a bunch of weight. Okay. His cholesterol levels went down. We reversed that prediabetes, so he's not in that pre-diabetic anymore. And when I followed up with him a few months later, how are you feeling? He says, Naomi, I thought I felt normal back then. Now I understand what feeling normal really means.
Yeah.
Waking up in the morning full of energy, no aches and pains, motivated to start the day, workouts, just, better mental clarity, just overall feeling better. And of course, libido improved,
Oh yeah.
so his wife was very happy. Yeah. And I mean, I still see my patients today. Not like now he comes in on a regular basis, gets his injections and monitor his labs every 3 months. And he's doing great.
Yeah.
Looks great, feels great. His relationship, his marriage has improved greatly. They're doing really well.
And something guys need to realize is that you're not the only guy. Like some guys don't want to come in because they'll be like, oh, I'm like the only guy going through this. There is reasons that there is services like this for guys. Because if it was just one guy, that would be like, it's not going to do anything. But since there's thousands of like men that this affects, of course there's like different services. So if they're listening, you're not the only guy going through this. Other people go through this all the time. And so it's okay. And for those that are still too shy to come in, you guys offer anything like virtual consults or anything like that too?
Yes, we do offer phone consultations. So they can give me a call. We can talk about it over the phone. And if I feel like they are a good candidate for testosterone replacement, then we'll go from there. I can even send them a lab order. They get their labs done on their own, send me the report. And then if it's confirmed, again, then they'll come in and we'll start treatment. This is a very common concern.
Mm-hmm.
I would say a big percentage of my patients are actually male patients.
Mm-hmm. Yeah, that was actually a question that I think you see more men than females.
For sexual wellness,
Mm-hmm.
absolutely.
And that's why like trying to share your man this podcast like so they can see it's okay, it's normal, it's fine to get it checked. That's the best thing that you could do in your relationship.
Yeah.
Rather than just thinking you're fine and it'll eventually fix itself, which is probably not going to fix itself. But you also offer for the ladies, because I know the majority of my following is ladies. You also offer women's services as well. Something like which is the PRP injection for women is the O shot. And is that something similar as the P shot?
Yes. We also use platelet-rich plasma, PRP. O shot, the O stands for orgasm shot. So we inject two spots for the ladies. The clitoris and then the anterior vaginal wall where the G spot is.
Mm-hmm.
Okay. So for women, you actually get multiple benefits, not just, the benefits that like men, the benefits they get from that is strictly like, improvement in their erections, improvement in their sexual performance.
Mm-hmm.
So for women, number one, it rejuvenates the vaginal canal. Okay. So it rejuvenates the vaginal canal. It helps with lubrication. So if women have any concerns with vaginal dryness or discomfort, it actually does improve those things. And it also sensitizes things, right? Because we're injecting the clitoris, we're injecting the vaginal wall. So you're getting more blood flow now to that area. Also, women who have something called stress incontinence, where, they'll sneeze, laugh, cough, jump, and they get a little dribble of urine.
Yeah.
It actually helps with that problem as well.
So is that like, have you ever seen those videos where they laugh so hard that they just like pee themselves? So like if you laugh pretty hard, this probably help that too.
Absolutely. Yes.
Does it help with like if they're feeling any sort of pain down there? Does it help? Because you said it helps with dryness. Does it help with any sort of pain down there?
Dyspareunia, absolutely. It could help with that as well.
Mm-hmm.
I have patients who've come in to see me because of that.
Mm-hmm.
And we do treat them with PRP, with the O shot.
And Is this safe to do long term, or is this just something that
It's absolutely, it's safe. Yes.
is there any side effects for it?
Not really. There are I can't see side effects. The only thing is like the day of the procedure, because we are using a needle. Anytime we even break the skin a little bit with a needle, there's always that, risk of the area getting infected.
Yeah.
But the risk is nearly impossible
On the
on the O shot.
on the O shot.
Exactly. The only thing is like same thing with the men. There's no downtime. So once the numbing wears off, I encourage my patients, hey, go have sex tonight. Go, take it for a test drive. The only thing I ask my patients on the day of is just don't submerge in like pools, hot tubs, bathtubs, but that's it. They can shower that same day and just back to normal.
Well, yeah, because usually pools and hot tubs, they have like other chemicals in there that could probably.
So we don't want the area to get irritated or again potentially get infected.
And then I know you mentioned this a little bit earlier too, because when we were talking about TRT, you guys offer the similar services for women as well. So like if they're struggling the same with like their libido, mood, their energy, that's something that you guys can also take care of. Like that way we don't have to get super in deep into that one. Do girls have side effects, or is it similar to what guys get?
So it depends. If a woman needs just testosterone, okay, again, we dose the patients accordingly. Initially, they start to get more sensitive. They're definitely like they become more. Gosh, can I just be like not all professional? Right
Oh
now?
yeah,
Just get
absolutely.
horny. They just get horny. Like they want to have sex.
Yeah.
Right. I feel like for men, the biggest complaint I think men have is like, oh, my girl doesn't initiate. I always have to initiate, right? Well, I find like when we optimize those testosterone levels for a woman, they want it. They initiate. Okay. With regards to like side effects, I would say maybe you'll your skin might get a little oilier in the beginning. So you might have a little breakout here or there, or you might start noticing a little more peach fuzz, like on in the lower face. But that's something that kind of regulates on its own over time. Because what happens if you're low on testosterone, right? Those cell receptors that bind to testosterone normally, like for a good while, like nothing's happening because you're so low. When we replenish that now, right, those cell receptors come to life. So one of the things that happens or could happen is like your skin might get a little oilier. Easy fix, something that, you can just get over the counter, like a facial wash to help with that.
Yeah.
Or like a little bit of peach fuzz. Like, honestly, I'll take that any day over feeling like how I felt before testosterone replacement.
Yeah. Well, absolutely. And another thing that people or ladies get, as soon as they hear testosterone, they think that they're going to get buff and like grow some hair. Like besides the peach fuzz, like they're going to get a full on beard.
That will happen if you're not being regulated properly. Okay. If you're being overdosed.
Yeah.
That's not going to happen when you're going to like a provider, who's trained in hormone replacement. That can happen if you're just, you get testosterone from somewhere and you're injecting yourself and you don't even know what doses you're taking in. I mean, anything could happen like that.
Yeah, because at that point, it's not even testosterone
not
replacement.
Even therapeutic,
it's
right?
more just like enhancing.
Exactly.
Because I like that you said that here, like you're just dosing it accordingly, like to what you need. Right. We're not like, hey, I'm going to give you a lot just so you can like really rev up.
Yeah, no, we're just getting you to that like natural therapeutic level where you should be like naturally.
And is this for women, because I know it's a little different, is this something that they have to stay on for a long period of time? Or is it something that eventually they just dose off of?
Well, again, if you get to the point in your life where like your ovaries are slowing down and they're not producing the hormones that they should be, then yes, it's something that you're going to have to be on long term.
And they probably won't even be upset about that because how they'll feel.
Exactly. Like, again, my personal experience, like once I got on testosterone replacement, because I was really low. Again, geez, I don't even know how I was functioning.
Same.
It was hard. But once I got on it, I was like, holy moly, what a game changer. Like, it's like I came back to life, like physically, like the energy levels, mentally, I just felt so much better.
Mm-hmm.
And again, the fact that like my sex life improved, that's huge.
Yeah, and which improves other uh parts in your life too, like your relationship, like maybe being a little bit more flirty with your husband,
Yeah,
like just
yeah.
like little things like that. Because you know, being intimate with somebody doesn't start the moment you penetrate them. It starts way at dinner.
Oh yeah.
Like
Even
you guys are
even
flirting.
even starts way like first thing in the morning.
Yeah, like you start joking around. But if you have to have that energy, if you don't have that energy, you're just like like we're not gonna do anything anyway.
Oh yeah. And there's another thing sometimes when I do a consultation with my female patients, ask them, "Hey, how's your libido?"
Hmm.
And then tell me, "I think it's fine. I don't know. I don't think there's any issues there." So then I'll have to dig deeper. Like, okay, well, picture yourself. Let's say you're in bed right now, right? And you're laying there, your partner's next to you, and you're like, I miss him, and I would get it on, but I'm so tired. I'd rather just go to sleep.
Yeah,
And they're like, oh yeah, that happens actually quite often. So the libido is not good.
yeah,
It's not there. Because like a good libido, a healthy libido means that you have the desire and you're gonna go for it.
yeah.
You're gonna do it.
You're gonna at least like if you get shut down, it's his problem.
Yeah. And like, I don't know. How often does that happen though? I mean,
That is
unless
true.
there's a real like, issue.
Yeah, and I'm glad you bring this up too, because when I go live and have conversations with these ladies, one day I did a poll on how long they were intimate with their partner, and the most I saw, this lady, she hadn't been intimate with her partner for 30 years. Yeah,
Wow.
just because he had issues, and I guess it became to a point where like maybe like it's not a problem, but they had so many issues within the relationship. And that's why I'm always saying like if you're going through issues, go get yourself checked. If they're going through issues, like, when is like too much? Like, are you gonna go like 10 years without being intimate with them? Are you gonna like how long are you gonna wait? At things like this. And that's why like this type of podcast, I'm like, this is perfect, so they can see that there's ways to get to fix certain issues. And so the only excuse now is that they didn't want to,
Right.
you know?
It's either they're not aware that there's even something that can be done,
Mm-hmm.
or they're just being hard-headed and stubborn, and they refuse to go do something about it.
Yeah. Oh, absolutely. And also, I know some services, a little pricier than others, but like, is it worth ruining and leaving your relationship, or getting these procedures done? Because there's some people who say, oh, I don't want to go to counseling. I don't want to do therapy. Like, I'm not going to pay someone for that. I'm like, well, they have, like, if they're going to be doing this full time, they have to provide for their family. So they have to charge. Just like wherever you work, you have to provide your family. So they pay you for whatever it is that you do. Like, imagine if somebody was like, I'm not going to go over there because of, like, I'm not going to pay for that. No, you have to, if you want these services, and they got to make money. They got to,
Sure.
like, survive, pay rent, like all sorts of stuff they don't understand.
Yeah.
Because I was able to understand a lot of the business side, like just learning, just having retail clothing stores, because everyone's like, well, you guys make so much more money. Like, yeah, there's a lot of bills though.
But overhead. What about staff?
Yeah,
right?
staff, overhill, inventory, lost inventory because people steal, broken stuff, or something comes up, something breaks.
Yeah.
They don't see all that. They just see like, oh, you got your business to this certain place. They must be like just flowing in cash, but there's reasons that, maybe making smart decisions, smart investments. Some people didn't realize that we wouldn't spend a dime on personal stuff. We would just like reinvest,
Right. It's just
reinvest,
investment.
reinvest.
Absolutely.
Like-
Yeah. And, when it comes to like medical providers and the things that I do, for example, people, also have to take into consideration all of the training involved and how much
Time.
this is not something that we learn in medical school.
Mhm.
No, this is something that, we have to do on our own and train and get certified and pay out of pocket to learn the procedures and to learn the correct protocols. So, I mean, for example, like flying to Alabama and training with Dr. Runnels, like a 2-day training, staying there for 2 days, missing out of work, time away from my family and my kids,
Mhm.
right? Um, that's a lot of money out of pocket that I had to pay,
Yeah.
right? But I'm investing in myself and my knowledge, right? So
Exactly.
that I can then provide my patients with the best quality. So, if you go to a provider that, and there's, you can research this. I mean, there are providers who are charging a third of like what we charge for the P shot, for example, right? But then you have to question why. Why? Well, because number one, for sure, 100%, we know this provider did not train and get certified on how to do this procedure correctly.
Mhm.
Okay. Because if he did, first of all, he would be listed under the provider directory, which I'm listed there because I trained and I got certified with this doctor. Second of all, the equipment that we use and just the kits, okay, that we use to pull the blood and spin the blood and get the best quality PRP,
Mhm.
okay, is it costs us an arm and a leg. Let's
Yeah.
just say that, So people have to be very cautious who they go to, and if it's too good to be true,
Probably is. That's
it's
why some
it's
people need to stop getting some of these services. Like I know it's cheaper in Mexico, but or any other
or like
country.
or Groupon.
Yeah.
Let's not even go far. Like Groupon,
if you're
right?
if they're
If
on Groupon,
if you're
like
seeing O shot, P shot on Groupon,
run.
be very careful.
Yeah.
And I've had patients actually that have come to see me, male patients, with concerns of ED, right? And I'll mention like P shot,
Mhm.
and they'll be like, "Oh, no, 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 I already got that. It didn't work for me." Okay, so when did you get it? Who did you go to? What's the name of the provider? Right? How much did you pay? I'm just curious. And they'll give me a number, and I don't even have to look that provider up. Like I'll know they're not in the provider directory, and they're probably using the cheapest quality equipment. They're
Mhm.
probably using a centrifuge that was given to them by like LabCorp to spin labs that are supposed to go to the laboratory,
Mhm.
not be re-injected into your body.
Mm.
You see what I mean?
Yeah.
So yeah, I've had cases like that. And then I'll do the P shot for them, and they'll come back and say, was a completely different experience.
Yeah.
Oh my God. Um, I've also had patients who came in and told me they've had P shots done before, but the provider didn't numb them up.
Ouch.
Yeah. Like, well, first of all, why? Second of all, was the provider a man? Was he a male? Yeah, he was a male provider. I'm like, he should know better.
Yeah, that
Why
hurts.
do that?
Yeah, that's insane. If you see them on Temu, definitely run too. Like you don't want to do that. And I know you. So the shockwave, it mentioned on your guys' website that it's not just for men, that you guys also provide it for women.
Yes.
How does it? What are the effects that women get from?
So for women, similar effects. Okay, it helps strengthen the pelvic muscles.
Mhm.
Also, just increases and stimulates more blood flow to the area, so they become more sensitive.
Mhm.
We've had women who get the shockwave and then they'll go home and have sex that night and be like, "Oh my gosh, like a switch turned on." So yeah, it's got multiple benefits to it. Also benefits where, if they're having issues with their bladder, where like, they'll cough,
Mhm.
sneeze, laugh, and they get a little dribble. It actually helps with that as well. It also helps strengthen the pelvic muscles so you have more support for your bladder.
Mm.
So it's got multiple benefits to it.
Yeah, yeah, and also, I was gonna ask you what kind of feedback people got from it, but you clearly said that they go home, they're intimate, and then all of a sudden they let you know, be like, it was crazy, like
Yeah.
it night and day,
Yeah.
and I like how you mentioned it earlier that you think you know what normal is until like you actually get what it normal's supposed to feel like.
Yes.
So like if you're still on the fence about something, just try it.
And
You know,
sometimes I will, like, if a patient comes in and they want to just get the P shot, or she'll come in like a female and just want an O shot.
Mhm.
If I feel like they can really benefit from the shockwave, sometimes I'll give them a session as a comp just to try it out. And 90% of the time, they will buy a package afterwards because they feel the difference.
Mhm.
Wow, this really made a difference for me. So I want to do more.
So what about because I know you also offer the Glitoxin. Is that how you say it? Glitoxin. Does that also improve like orgasm, or is that just more of a cosmetic?
No, so that is it's for improvement of again sensation, and yes, to reach the orgasm.
Mhm.
Okay, some women they're like like they really need a lot of stimulation um for longer periods of time to reach that point where they can orgasm. So with the Clitoxin, okay, we injected just in the clitoral area.
Mhm.
Okay, and again, what that does is it relaxes the smooth muscles that surround your blood vessels. So when you become aroused, okay, you get more engorged in that
Mhm.
area. And that, again, in turn gives you just higher levels of sensitivity so you can enjoy sex and get to the point where you do climax, you do orgasm.
Is there any side effects to that one?
Nope.
It's like besides being too horny, and that's not a side effect.
No.
um, what about the peptide therapy for? Because you also offer it for women.
Yes.
Like, who is that for?
So which peptide?
Um, to boost libido.
Okay, so yeah, the PT-141. Yeah, so that can be used by men and by women.
Mhm.
So men, again, it'll help them with their erections in general. For women, it helps them kind of just sensitize their whole body. I would say it's comparable to like if a woman smokes some marijuana,
Mhm.
right? It helps relax her and she just becomes more sensitive and just feels more. But then she has that head high,
Mm.
which she might not want that head high. So the peptide does something similar. It gives you that body high without the head high. So, you can inject that in the morning, have good morning sex, go to work and not have to worry about being high.
Mhm.
And then again, because it's in your system for up to 48 hours. So if you want to go home later that night and just be spontaneous and, just get it on, you're good.
And when you're saying sensitive,
Mm-hmm.
you're talking about the body. You're not talking about their feelings, right? She's not gonna be
No.
like,
No.
"Oh my God, guess what just
No, no,
happened?"
no.
I'd be like, "Oh."
No, none of that. No.
So just sensitive in the body wise.
Body. Yeah.
And does this also help with like their energy, or is that a different type of peptide?
That's different. Yeah.
Okay.
That's a different type of peptide. So, again, if energy is a concern, right,
You'll
then
take a different route.
I
With
take
that.
a different route. Yeah. There's, you don't want to just band-aid something. You want to get to the root cause and you want to fix that.
And what is this? Because I also saw on there the wellness programs. What is that?
So wellness in general could be, it could be a combination of different things,
Mhm.
overall our health and wellness. So, um, if we're deficient in hormones or if we're deficient in certain supplements like vitamins or minerals that we need, if we need to optimize our thyroid because it's a little sluggish, like
Mhm.
all of those things come into wellness. Also doing things like, like detoxing your body from time to time that also is important for our health and wellness. Excuse me. So it varies for everyone. The wellness program, somebody will come in, I want a wellness consultation, right? It could mean something completely different what we do for one compared to someone else because the needs are different.
Yeah. So that is just like a combination of different. Uh, is there any side effects to doing a bunch of different treatments, or do you make sure that there's like very minimal? Because instead of being like, oh, you need this, this, and this, but since you're gonna be taking this, this, and this is gonna happen. Like, is there any like major side effects for
Better
doing something
quality
like
of
that?
life.
Too horny, like, which is not a side effect.
Well, we don't want, listen, we also have to be cautious so that our patients don't get hypersexual, right? Where all they're thinking about all day is like sex.
I don't see
So-
that as bad. I'm just joking.
So, we also, again, that's where it's important for us to dose properly. That's why labs are important.
Yeah.
Just in general, following up with the patient, like, how are you feeling? Are there any concerns? What are your symptoms? And then again, looking at the labs. If I see their labs, if they're, if their testosterone levels are really up there, higher than what I'm comfortable with, then we got to, work on, we'll reduce the dose. We'll
Mhm.
kind of, tweak it. So, we rarely get to that point where patients are just like hypersexual and all they're thinking about all day is like, oh my God, I'm horny. I just want to go home and have sex all night. No.
Is there like based off, because I know you've been doing it for a while, like doing these like the wellness programs, has there been an example that stands out that such a huge transformation? You know, they came in like this is where they're at now.
Quite a few, cases where, I mean, just that one patient that I told you about earlier, the one that was dragged in by his wife a couple of years ago, and now he's a regular.
Hmm.
Um, I mean, that's a huge transformation right there. Just again, reversing all of those things in his body that were occurring. Again, his A1C levels, again, which puts you in like a pre-diabetic,
Yeah.
um, elevated cholesterol, okay, blood pressure going up, just overweight in general, low energy, again, can't concentrate. Um, all of that was reversed. So his quality of life has improved greatly. His relationship has improved. I have a patient who, oh my gosh, she came in because she was feeling also fatigued, she was putting on weight. She couldn't understand like what's going on with her. Her joints were aching. She's like, I feel like I've aged overnight. We did her labs. Again, we optimized some things. In one case, like her thyroid was slow, sluggish. She was low on certain vitamins. Her hormones were imbalanced. So we took care of all that. We optimized all of that, and I mean, she's feeling like she's back to when she was 25. She's working out. She's build muscle. She's leaned down.
Mhm.
She feels great. Also, I feel like that helps them in general, even in their workplace.
Better mood.
Better mood, better performance. Okay, and I mean, then that in turn helps them even get promotions.
Mm.
Because they're motivated.
Yeah,
Again,
just
like
that quality of
the
life is
quality,
just
just
way
in
better.
general, absolutely, yeah.
And especially if you see that motivation. And one thing that you mentioned, it also helps people's relationships, because I think maybe that's where a lot of it stems from, is like they're having issues in the relationship, and like they're trying to fix it, especially with guys in that whole ED thing. If it got to the point where they're asking me questions, or they're asking other people questions, or even thinking about what's going on, there's probably issues going on in the relationship already. Like, why doesn't he want me? Or like it just goes hard, goes soft, right? And I'm sure you've seen a lot of relationship get better, like after some of these services, like,
Yes.
because I'm sure they're excited to be like, yo, like this is like she's actually like into me again, or like, he's actually into me, and things like that.
Again, it goes beyond just the sex.
Mm-hmm.
Okay, because yes, there are relationships, I mean, that we've helped save. I had cases where like patients would come in, a woman, a female patient would come in and be like, I feel horrible. I'm irritable all the time. I can't sleep at night. My husband pisses me off. I can't stand him anymore. I just want to get divorced. Like they're just, oh my gosh, they're like wacko.
Mm-hmm.
And I talk to them and I say, look, you came here because you need help. You want me to help you. Okay. Do me a favor. Don't make any decisions right now, please. Don't make any like rash decisions. Give me 2-3 months, okay, to help you.
Mm-hmm.
Then, if you want to separate from your husband, if you want to get a divorce, by all means. But just wait, give me a chance. And I've seen, again, this is not just one case. This is multiple times I've seen this, where we check the patient, we see what's going on, we optimize, we fix their hormones. Within 2-3 months, like they're balanced again,
Mm-hmm.
right? They're stable. Do they want to get divorced at that point? No. Like we save their marriages,
Yeah.
simply by optimizing their hormones. Now, same thing happens with men. When their hormones, when they're low on testosterone, again, they get irritable. Also, they get moody. They're lazy. They just don't want to do anything.
Yeah.
Now you have your partner or your kids, just constantly nagging you. Hey, we need to do this. Hey, we need to go there. Hey, we need to do this. We need to get this done. We need to get this fixed. They just don't want to hear that.
Yeah.
And what happens? Like they'll snap. They'll say something disrespectful, or they'll start an argument. the relationship starts to suffer.
Yeah.
So once we optimize their hormones and just overall their health and wellness, they become stable again,
Hmm.
and things just start improving. So it's very, very important. Again, not just for the libido or or the sex, just in general for the relationship.
Yeah, and I think just based around the whole relationship, these things need to be brought up as soon as it becomes a problem because yes, you can save them, the relationship. Because I'm always like, yes, like if you did what you could to try to save the relationship and it's not working, then at that time, so instead of waiting until it's too late, like this is your ultimate, like the last straw, like or I'm
Yeah.
out. Because even fixing yourself, it could be like it still didn't fix anything. Maybe it fixed him, but now he just took off with somebody else because like now he's good to go, right? But instead, like when it starts becoming a problem, because I've seen it a lot in women, is that they wait. It's a problem, but they don't say anything, But you should be wanting to say, like, if as soon as your guy's not intimate, say you're doing it 4 times a week, and then all of a sudden it's 3, and then it's 2. It's gonna start getting longer and longer unless you say something. Be like, what happened? We do usually do it 4 times. Like, were you tired? Was it me? Like have that conversation then, because like if you wait until 6 months, a year down the road and be like, what's going on? Be like, well, we've gone this long without
Right.
doing anything. Like, why is it a problem now? Like, like why is it an issue? So it's better to, if they're having issues, have
Communication.
And if you're struggling on how to present this to your man, they can reach out to you and like maybe, hey, like my man is going through this. Like, what are some things that I can tell him to try to get him? Because I think one big thing for a guy would be like the virtual consults, because guys, just how guys are, they would rather be like, well, if I can do a video call, I'll have the camera off,
Yeah.
like,
Right.
and I'm sure you're like cool with it, but
Yeah.
eventually, if it gets to a point where like, hey, I'm gonna need you to come in, by then you've already built that rapport.
Right.
They're a little bit more comfortable with you, so it makes it a little bit more easier. But I always try to reemphasize to the ladies is stop assuming that it's eventually gonna get better.
And that's and that's again, I don't want to say a problem, but it's common for us ladies, for women to assume things, right? So we're in our head. We are in our head a lot, and we're just overthinking things and like analyzing a conversation that we might have had, and we're just assuming things. Where in reality, I feel like men's brains are wired so differently.
Oh, absolutely.
We're just more complicated. But that's why I feel like, just in general, like communication in the relationship is really important.
Mhm.
Okay. Even the smallest things, or the things that you think might turn into an uncomfortable conversation, being able to communicate is important. So like when it gets to the point where there's something that you're concerned about the relationship, or about, your partner's health and wellness, you should be able to present that to them without them becoming defensive about it.
That, and it doesn't matter who you are in the beginning, having a conversation that's similar to this, it's going to be uncomfortable. Like there's no right way, but once you start having those conversations, it's easy to have these conversations because you already got past that awkwardness. Like I know when you get into a new relationship and maybe that first argument is kind of like awkward feeling afterwards, or like if you brought up an issue, a fight started, an argument started, and then after that you can bring up issues because now you went through that. Yes. Now it's easier to have that conversation, and the sooner you bring this up, and if they're going through issues like your guys' first year of dating, like this is, I always tell the ladies, this is the perfect time because they're trying to court you at this time. They're trying to do whatever it takes to get you at this time. And if you tell them, hey, you need to go get this checked, trust me, if the guy is into you, he's going to be like, tell me where. Tell me where. I'm there and I'm going to make things happen. Don't wait until like, because I always tell them too, like if you bring something up and it makes them leave upset, like leave you, it was only a matter of time before they were going to leave. That was just expedited the process. So don't ever be afraid to bring up an issue or like anything about the relationship, and especially intimacy. I was like, how are you in your first year having issues being intimate with somebody? This should be like probably the highest ever, because when you first get to know somebody, you go from having intimate, like being intimate 4 or 5 times a day, it goes down over time, but it shouldn't just, there shouldn't be any, right? Like that's a huge problem. So the sooner you can bring up problems, the better. And so again, if there's ways that they can, if they need to learn how to bring some certain things up, maybe learn some terms or get some more information. We covered a lot of the things on your guys' website. So like if you like go and follow along, you'll probably be able to see them there. And if you actually want to get a hold of some people, your guys' number is?
Our phone number is 480-447-8166.
And the website is?
The website is besowb.com. We also have an area on our website where patients can enter their information and their questions.
Mm-hmm.
We get that as an email, and then we can reach out to them. And sometimes, like, I'm happy to make the quick phone call. Doesn't have to be a full-on like consultation.
Yeah. Sometimes
it could be a 5-minute call. I can just clarify some things, answer some questions if they have any concerns, and see if they're even a good candidate, or if we're a good candidate for them.
Mm-hmm.
But yeah, they can reach out to us via, just phone call, email, send us a DM on our Instagram. Our Instagram is beso.wb.
Mm-hmm.
So, there are different ways to get in touch with us and send us questions. We're happy to answer them. And, we do also from time to time, I like to do just a live. When we have some time, we'll get on a live and we'll just answer random questions that people have.
Yeah, and like get in there, have a conversation, because sometimes that's even easier than a text or a DM, or somebody else asked the question that you wanted to ask. So now you're like, okay, I don't have to ask this question because somebody else, and they become informative, because I do the lives all the time too, and people just ask questions and you just like have a conversation with them because you're trying to explain what's going on. And sometimes in a group setting like that, it's a little bit easier.
Yeah.
So I think the biggest thing too is if you're trying to, like, if your guys' relationship is really important to you guys, like, and you're struggling in a lot of these areas, like, it's definitely worth the call. Like, even if you don't do anything,
right,
it's worth the call to see what's available for you, what you can do out there. Or if you're just trying to take your relationship to the next level, because there's the people who also, their relationship gets stagnant. Like, there's nothing, like, everything feels like a chore after a while.
Yeah.
But if you, like, say they do something that enhances their orgasm, they're going to be like, oh my God, like, this is amazing. And guys like myself, I actually get turned on by seeing the girl, like, having a great time. Like that, I'm like, hell yeah.
Yeah.
That gets me off. So if they do stuff like that, now I'm just like,
yeah,
it makes me feel better,
right?
Mm-hmm. And then I would never want to get to the part, like, that struggle of not being intimate with somebody. And then after, like, I got on the TRT, like, just energy wise, like, it's crazy.
Yeah.
So I always tell people, I'm like, maybe it's that. I'm not saying it's that, but I take it. I feel amazing. I feel like in the morning, like, I have some people who were about the same age and 2 different, like, energy levels.
Sure.
Like, theirs is like, whatever, like, just going along, and I'm just like, what's next? Like, let's do this, let's do this, let's do this. Like,
but it feels
motivated.
It feels amazing, right? Because you're productive,
Mm-hmm.
right? You have all this energy, so I feel like just your day goes by so much better. Just life is great.
Yeah.
I mean, I'm up at 5 a.m. Every morning. I'm full of energy. I'm ready to start the day. Go for a walk, go do some Pilates, take a shower, get ready for work, like meditate. I mean, I just have a, great start to the day because I'm energized.
Yeah.
I feel rested. I feel good.
Yeah. And like, no better than the person who owns it to show, hey, like, this is me. Like,
practice what we preach here.
Exactly. Like you said, you like on some of these services that you like to take it for yourself just to see what it feels like, what it is, and if it's even worth, like, because what if it did like very minimal stuff? You're like, why am I going to offer that to somebody when it doesn't do very much for them?
Right. And I'll try things on myself first, or my husband will be my guinea pig as well. So he was the first one that I did the Botox on, for example. I mean, I've been doing his pee shots for years, but then Botox, I was like, oh, we got to try this, babe. Let's see what happens.
Yeah.
So he was my first Botox patient. And I mean, I was happy. I mean, I noticed difference. I was like, okay, this is
And I'm
good.
sure it's also like if you struggle in that area, it's very your confidence level goes down a lot.
Yes.
And so imagine like if you want your that confidence boost, like get yourself checked. And then because like, if you're doing great down there and satisfying your woman or women, like I don't know what you're
Right.
doing, but
Right.
that confidence level goes through the roof.
Yeah.
So every week I like to give a call to action. So this week, ladies, what I want you guys to do is like if you guys struggle with any of these things, if you're in the Arizona area, get a hold of her, get a hold of Naomi. I'm gonna link all their information and just have a conversation. You don't have to book anything. You don't have to do anything. Or if you have any questions, get a hold of them. Or if you're in a different state, definitely look for a local place. If you're looking for some shots, you said that there's there's a list of like certified people. Does
Yeah.
it show locations like where they're at?
Yes.
Perfect. Like if you're not in the Arizona area, or if you loved her personality, which her personality is amazing by the way, and want to travel to Arizona to get that done, she's definitely here for you guys. So this week, that's what you're gonna do. If you're going through issues, or if you're looking to take your relationship to the next level intimacy wise, this is what better way.
Right.
I always tell people include toys, include this into your guys' relationship. But if you can enhance like his orgasm, your orgasm, him harder, like it's a win-win.
Why not?
If you ask
Right?
me. So let's do that this week. That's going to be the call to action. So make sure you guys do that if you're struggling. And also if you know somebody who's struggling, accidentally text them the link to the podcast. Be like, oh, hey, he said this joke in there. You should take a listen to it, because some guys, still struggle either way. But I want to thank you for jumping on and, just having this conversation and educating all these guys and the ladies also so they can try to make a better, informed decision, like to the way they can communicate to their partner, right? Because
Yes.
that's a big thing is
Yeah.
communication. And I'm glad you mentioned the relationship issues because like it fixed relationships. It may there's a high chance of the relationship being fixed, and like if you can do one of these things first before you guys actually call it quits, like that it could save the relationship.
Absolutely. Yeah.
And so if the relationship really means that much to you, like I don't want it to end, try whatever you can.
Make the effort. Absolutely.
And if and just to enhance the relationship too. So again, thank you guys.
My
I'm gonna link
pleasure.
all her information. So you guys make sure you guys go check her out. So, and again, thank you.
My pleasure. We're always here for anyone who needs, a little support, needs help. That's what we're here for. I feel like that's my life's mission, is to help others. I personally went through these experiences and it was very frustrating and disappointing because I didn't get the answers that I was looking for right away.
Mhm.
And I just hate the fact that, again, my marriage was affected by it. Even my kids were affected because mom's always tired.
Yeah.
Mom doesn't want to do anything. So once I figured out what was going on with me, and once I now specialize in this, and the amount of people that I was able to help, and the amount of relationships we were able to help, that's really, really important for me. And I encourage anyone, who is struggling or is just not sure what's going on with them,
Mhm.
just reach out to us.
Yeah.
We're here to help.
Yeah, there's no commitment reaching out to somebody. They just more information, and then you just go from there.
Yeah.
And I love that you said that you love to help people because that's what I wanted this platform for, is like people like yourself that are able to help and educate other people, because like myself, I didn't know a lot of these things and that these things were available. So this also like, hey, I did this podcast with Naomi. She talked about this. Go to her for more information, but this is kind of what it does.
Yeah.
You know what I mean?
Yeah.
So, because I can't help people with what I don't know, right? So again, thank you for joining us, and make sure you guys tune in, hit her up, and I'll see you guys on the next one. See you guys. Say bye.
If it ain't toxic, it ain't love. SkarxFace talk real. No filters here. We love too hard. We argue then cheer. Red flags up. Shots in a cup. If it's messy, then you know it's uncomfortable convos.
Yeah, we toxic, but we vibe in a style.